Kathryn Serkes. She's the Director of Public Policy Affairs at AAPS. That's the Association of American Physicians and Surgeons.
That's right.
And Mr. Representative Congressman Mike Kaufman from Colorado.
Right. Great to be with you.
So thank you for joining us. We are spending some time talking about the bill that is before Congress right now and trying to do everything we can to educate America and engage them and encourage them to call their representatives. If you want to voice your opinion, call 202-224-3121. Kathryn, why don't you share just a little bit of your perspective on the current bill before Congress?
Well, one of the things that I think is really key is that the public needs to know that physicians are not universally behind this. The AMA does not represent doctors on the whole. In fact, the AMA only has about 19% of the membership of the doctors across the country. So that's key. So when the AMA announces its endorsement, I'd like to say that that's not such a big deal because most of the doctors in the AMA are also they're academics, they are retired, or they're physicians in training. So that's first off. By and large, physicians do not support this. So, and AAPS has been very, very, very much opposed to government medicine. We believe in healthcare reform. We just want healthcare reform that puts patients and doctors in charge, not what we're seeing from the bills that we're seeing. I think it's really interesting, too, that we have some new numbers that haven't even been published that I wanted to share with your audience right away. We know that now we did ask doctors if they would be willing to participate with patients in a public plan. 72%, this is a survey of about 1,200 doctors, 72% tell us that they would not voluntarily.
Now, why do you think that?
Well, because it's more government medicine. Here's how I always explain it. The problem for doctors right now is their government is in the way. They cannot treat patients for free if they're Medicare eligible patients. They can't even do that. They actually have to pay for translator service and some things like that out of their own pocket. Government regulations and regulatory hoops right now are what are making it really difficult for doctors to doctor. We like to say that physicians are sworn to do no harms. It should be really maybe the government and the politicians who do that because that's what's standing in the way. Doctors spend 25% of their time on Medicare compliance. That's not Medicare patients, that's Medicare compliance. So they're tired of being insurance billing clerks. They're tired of being insurance government file claims processors for the government. So if they will not participate in the public plan, then even if people have insurance, where are they going to find the doctors? That's the problem that we have.
Yeah, good point. We have a question from Facebook here from Keith. When under the Pelosi plan, will they begin telling doctors and nurses that there are too many healthcare providers in their area and force them to relocate? Could they do that after an insurance takeover?
Yeah, that's a really interesting question, and I want to mention that we actually set up a reading room for doctors yesterday, and we've had a 24-hour marathon of reading the bill, so we've actually read the bill. You know what? My short answer to that is it really won't be a problem about trying to shut out doctors. The problem will be trying to find doctors when this is finished. Because we know that about 60% of doctors are telling us now, too, that they will retire earlier than they ever thought possible. That flat out, if they can't practice medicine, that keeps them in charge, that they're responsible to their patients, not to a government requirement, that they will just walk away and find something else to do.
Right. Congressman Kaufman, so you're from Colorado. What have you been hearing about this bill?
Well, I think that people in Colorado are very upset, particularly small businesses in my congressional district. What I think a lot of people don't realize is the fact that this puts a significant tax on small businesses that can't, not only that if they can't afford health insurance, but if they can't afford the right health insurance and can't afford the exact the minimum percentage requirement that's in this legislation. And if they can't meet all those things, and there are businesses in my district that offer health care but have had to trim back some of the benefits just so that they can keep people employed, can keep people on their payroll. And what this says is, forget it. What this says is that if you can offer the right insurance as we in the federal government define it in the insurance exchange, and pay 72.5% as a minimum for an individual, a family for a full-time employer, 65% of the whole family. If you can't do that, then we're going to hit you with a surcharge up to 8% of your payroll.
Yes.
Now,
yes.
that's not about, that's not income tax where if you're making a profit. This is whether or not, this is if you're trying to keep your doors open. We're going to make sure that either you lay off people or you shut your doors altogether. I mean, we ought to be job creators, not job killers. And this bill is a job killer.
So at the very time when we're losing jobs, we've lost 3 million jobs since January, and we recognize that small businesses are our job creators, this bill is going to hurt small business owners all across this country. So do you think that there's a better way?
Oh, I think there's a better way, and I think Republicans are going to certainly offer one as a substitute motion, one that's really based, helping people with pre-existing conditions, one that has some market-based reforms to bring down costs,
and what about
deals
for
with
small
tort
reform,
and doesn't put a burden on small businesses, and I think that's a huge issue. I mean, it is this is absolutely stunning, not just in its complexity. And I think for me as a former small business owner, I mean, that's the relevant part that I focus on, is what it's going to do to small business. And I think that it is clearly a job killer.
Well, I thought you made a good point. We're talking an 8% tax on anyone whose payroll's over $500,000. And in the Republican alternative, it would allow small businesses to band together and seek health care solutions. It would allow them to go outside of state boundaries and maybe access some more affordable plans than they have right now. Okay, I have another question here. This is from Patrick in Washington State, my home state. I recently moved here from Indiana. That's Mike Pence's home state. And my insurance cost a lot more. Why can't I buy insurance across state lines? Okay.
I too am a Washingtonian from Washington, Seattle, and I consider myself a healthcare insurance hostage because in Washington State we are so mandated and regulated with our insurance there. I only have my choice of about four insurance companies and just a couple of policies because I would like an HSA. I can't buy one. Every week I send Patty Murray a letter explaining how I'm being held hostage in Washington State, and she hasn't really written me back because there are so many mandates. I am overinsured. And I actually had an actuary crunch numbers for me. If I could buy the policy that I want, I would only be spending between $47 and $52 a month. Wow. Now I'm spending $190 a month for a policy I don't want. So if we had the cross-state purchasing that is in H.R. 3400 and the Republican alternative solution from the leader's office this week, I could go outside of Washington State and find the insurance policy that I really want.
There's a lot of citizens in Washington State that would like that. Okay, at this point we have a video question.
I'm Uday Palad, live in Pittsburgh, grew up in North Carolina, and I would say my question is, how would you make the process more transparent or efficient?
How would you make the process more transparent or efficient? Do you have some thoughts on that, Congressman?
Well, I think the difficulty in the health care bill, the Pelosi health care bill, and it goes back to a lack of competition. And I think transparency and competition go hand in hand. And when they say
this bill's been written all behind closed doors.
All behind closed doors. And when they say that we have to have a public option because we need competition. But what is amazing is, but then they don't allow competition across state lines. And so, what we need is market-based competition between health insurance carriers to bring down price. But certainly the process in and of itself has not been a transparent one in terms of drafting this legislation. And it's stunning to me that it's been all done behind closed doors, all done in secrecy, without any other input beyond a narrow group of people on the Democrat side of the aisle.
Okay, so we're getting close to the end of this segment. Closing thoughts?
Closing thoughts. Physicians are almost are overwhelmingly against it. They know that it will help, that it will interrupt their ability to be responsible to their patients, not to insurance companies or the government. Already 25% of doctors around the country are refusing to accept new Medicare patients, and their first reason isn't even money, it's about government interference. The bill that we've seen before us now will only increase government interference. Yes. That's what will help streamline the process.
Very good, very good.
Well, I've been a small business owner in the state of Colorado, and I know that this bill is going to be a job killer. And the National Federation of Independent Business has certainly come out in defense of small businesses against this bill. And so I hope we can bring common sense to the Congress and be able to defeat this bill. I know the American people are against this.
Thank you. Thank you both very much. Thank you for joining us this hour. Remember that your voice is power. Unless you speak up and let your congressman know that you don't want the government to run your health care, the Democrats are going to ram this bill through Congress. Call your representatives, especially those so-called blue dog Democrats.